Welcome back to Midday. So Moderna coming out today changing its recommendation for getting a booster in 5 months instead of 6, just one of the many developments in the fight against COVID this week. So to help answer all your questions, I want to bring in Dr. David Winter from Baylor Scott and White Health. Good morning, Dr. Winter. How are you doing?
Good morning, Suzanne. Good to be with you.
Yes, so with the current COVID-19 surge, how are hospitals doing with bed capacity, ICU rooms, and ventilators? What are you seeing right now?
Well, we've heard the county hospital Parkland is full and overflowing. I talked to Steve Newton, president of Baylor University Medical Center downtown. He tells me that the COVID cases have doubled from last week. What's interesting is the percentage of those cases in the hospital on ventilators in the ICU is smaller than it's been previously, so that's a good thing. But still, the cases are going up. Now, they still have capacity, and they still are able to do elective surgery cases, but they're watching on a day-by-day basis, and that could change at Baylor and other hospitals in North Texas.
Yeah, it just seems like those numbers continue to rise week after week. What do you think it's going to take to turn this surge around?
You know, it's a good question. This virus, what its job is to transmit from person to person to person. That's just what viruses do. And we need to stop that spread, or it's going to continue to do that. And how do we do that? Well, it's masking, distancing, being thoughtful and careful around crowds. I know we're all tired of hearing about that, but you know, the virus doesn't care how we feel. It's still going to try to spread, so we have to counter that with steps to stop it, Suzanne.
So is it possible that the new Omicron variant just transform into this mild recurrent infection like the common cold?
You know, I can see that happening. I think that's a possibility, but it's important we don't let our guard down, because I'm concerned as this virus continues to hang around and spread, it can mutate again. The next mutation could be more serious, more deadly, resistant to vaccines. So we still need to continue to try to fight off this virus.
Okay, and then another question I have for you is, so the CDC has recommended that booster vaccines be given to everyone age 12 and older. Do you think this is likely to make a difference in the fight?
I do. There's no question that people that are vaccinated have milder cases than folks that are unvaccinated. And then if you get a booster, you do even better still. So I'm a big proponent of the boosters. I'm glad that the FDA has approved those now for younger folks also. Boosters do make a difference, Suzanne.
All right, Dr. David Winter, thanks so much for joining us here on Midday and answering those questions for us.
You bet. Thank you. Have a good day.